Hello and welcome to the ROHDEO webinar entitled A State of Decay, a report on older adult oral health in Texas. I'm Annalise Cothran, ROHDEO coordinator. Thank you for joining us today. I thought we would start by giving a little background for those of you who may not be familiar with ROHDEO. The repository of oral health data for evaluation and outcomes is a statewide database of basic screening survey oral health indicators, access to care information, and demographic data. Programs across Texas contribute data annually, and each year data are synthesized and published on the ROHDEO website for public access. ROHDEO is a partnership between UT Health San Antonio School of Dentistry and the Texas Department of State Health Services Oral Health Surveillance Program, supported by funding from the Health Resources and Services Administration. This webinar series aims to bring dental public health information and initiatives to both ROHDEO users and contributors, as well as national partners who are interested in learning more about the oral health of Texans. You can learn more about ROHDEO by visiting the website www.rohdeo.org. I would also like to introduce our co-sponsors for this webinar, the Texas Oral Health Coalition. Beth Stewart serves as the executive director. Beth would like to say a few words of welcome.
Yes, thank you, Annalise, and welcome everyone. TechSOC exists exclusively to promote and support the overall oral health of all Texans, and does so by working wherever possible to build, support, and assist widespread collaborative efforts between oral health professionals, other providers, communities, and other stakeholders. The mission of the coalition is really to promote oral health across the lifespan by advocating for optimal oral health for all Texans through statewide partnerships. Today's webinar is a great example of one of these partnerships. So we want to thank ROHDEO for inviting us to help co-host this important webinar. Another partnership that I wanted to mention was the Texas Oral Health Conference that you can see advertised on your slide. This is actually a true collaboration to improve oral health between 4 different entities: the Texas Oral Health Coalition, the Texas Department of State Health Services Oral Health Surveillance Program, Advancing the Oral Health Movement in Texas, Atonement, which is a collaborative initiative between TechSOC and the Texas Health Institute, and then also ROHDEO, the Texas Repository of Oral Health Data for evaluation and outcomes. What we've done is really pooled our resources to create a unified meeting. Instead of each of our entities having their own event, summit, or metric summit, we pulled everything and decided to have one big, large oral health conference this year. It will be July 25th through 27th of 2018 at the J.J. Pickle Commons Learning Center in Austin, Texas. There is the website at texasoralhealthconference.com where you can go to our website and find out more details about the conference, speakers, courses, schedule, and access your easy online registration and payment. So we want to invite you all, and we hope to see you there.
Great, thank you, Beth. This webinar is the 7th in the ROHDEO series. Previous webinar topics include collaboration on health IT, public health messaging in a digital era, older adult oral health programs, access to care data presented by the ADA Health Policy Institute, using data to influence oral health policy, and tobacco control strategies for oral health. As mentioned, this webinar is being recorded and will be made available for review later on the ROHDEO website. You can also review any previous webinars on the ROHDEO website under the Webinars tab or on the ROHDEO YouTube channel. We're also on Facebook and Twitter, so give us your feedback, follow us on social media, and tell us what you'd like to see in future webinars. We're excited to keep the conversation going. Lastly, I would like to mention that ROHDEO has redesigned our website and visualizations. If you visit the State and County Health Data tab, you'll see that we have 2 pages of visualizations available with more planned stories along the way. Feel free to visit and give us feedback. Before we start, I wanted to review a few housekeeping details. This webinar will last approximately 45 minutes, after which Ms. Rogers will answer questions. If you have a question, please type it in the question box throughout the webinar. If typing in the chat or question feature, please make sure that you are typing to the entire audience or sending to all. At the conclusion, the presenter will read and answer questions. If she does not have time to answer your question, or if you have a follow-up question, we will provide Ms. Rogers' slides and contact information on the ROHDEO website. Or you can email us at rodeo@utsca.edu, and we will contact the speaker and connect you. I would now like to start the presentation, A State of Decay, a report on older adult oral health in Texas, presented by Ms. Bianca Rogers from Oral Health America. Bianca Rogers has been with Oral Health America since 2014. In her current role as the Public Affairs Manager, she works to establish the organization as an integral voice in advocating for legislation that promotes oral health equity. She is responsible for overseeing the organization's advocacy initiatives and legislative priorities, including Oral Health America's initiative to integrate oral health in Medicare. Ms. Rogers began her career at Oral Health America as an intern at the Smiles Across America program. Ms. Rogers graduated from Loyola University in Chicago with a BS in Health Systems Management. So without further ado, please welcome Ms. Rogers to begin her presentation.
Okay, wonderful. Thank you so much, Annalise and Beth, for inviting me today. I'm really excited to share with all of you Oral Health America's most recent report on older adults' oral health. And so we can get started. Just really briefly about Oral Health America. So you might notice that we have a new logo. We've actually just recently rebranded. Our organization has been around for 60 years, and the great work that we do is going to continue, but we wanted to start to reframe and how we look at oral health, because we know it's much more than oral health. It's about total body health, and so that's what we hope to accomplish with our new branding and our new messages. And we have two signature programs, the Smiles Across America program, which focuses primarily on school-based sealant programs and working with partnerships within that, and then the Wisdom Tooth Project, which is where our State of Decay really fits in, and that is looking at how do we improve the oral health of older adults, especially since it's easy to find kids, and they're usually in school, but it's a lot more difficult to reach older adults. And so just a brief agenda today. So I'll go over the report, talk about some policy recommendations that we've put forth. I'll talk a little bit about what state spotlights are, and we've introduced that this year. A couple of tools and how you all can get involved and advocate for some of these policy recommendations, and what this report looks like in the future. So to start, what is a state of decay? Well, it's our fourth state-by-state report analysis that looks at the oral health. Just in simple terms, it looks at the oral health of older adults, specifically those that are 65 and older. Before I got started, I wanted to do a shout out to our Scientific Advisory Committee. This is a committee that we commissioned for this report for the first time. We wanted to make sure that we were voicing all the different segments in oral health. So we brought together individuals from aging, from public health, from academia, and of course from research and state advocacy to really make sure that that the voice and the messages that we were illustrating were fully, I guess what I want to say is that we kind of hit all of our marks, so we weren't just one-sided. So why release a report card? And actually, I don't like to use the terminology report card, but that's kind of how our report has been branded. And I actually hope by the end of this presentation, you all will see that as a positive tool versus what some have said this is maybe a negative tool. And so I want to start with just a brief history. So in 2003, Oral Health America commissioned the State of Decay series to provide the public with existing data on a state-by-state basis. And so the first volume focused solely on the cost of services and financial reimbursement rates as the primary contributing factor to older adult oral health. However, while cost continues to be the greatest barrier, we know there are a lot of complex variables at play. So beginning in 2013, we expanded the report to highlight both public health and healthcare delivery factors. So now on the other side, we have all heard about the silver tsunami and the projected increase of older adults in 2030. Well, in fact, in 2029, the oldest baby boomers will be turning 83, and they're going to have significantly different health and oral health needs than those who will be turning 65 that year. So it's really important for us to be publicly sharing data, and this is why we created a report, so we can establish the need. But primarily, we wanted to release this report as a tool for states. Our hope is that state advocates will begin the conversation with legislators, will use this to build coalitions, in order to create change and to take action. So that's really the primary purpose behind this report. So to jump into the variables on the screen were selected by the advisory committee, and they also came up with a set of criteria. So those criteria were that the data had to be current, less than 5 years old. It had to be something that was regularly measured, credible, representative of the population, valid, reliable, relevant, and actionable. And so I'll just briefly mention what each of these variables looks at. So first, we look at severe tooth loss, and that's the loss of 6 or more teeth. The dental visit in the past 12 months, and again, this is specific to those 65 plus, and those two variables come from the BRFSS data. With regards to adult Medicaid dental benefits, so this is a little bit unique. What we did is we partnered with MSDA, the Medicare Medicaid CHIP Dental Services Association, and they do a survey of the Medicaid directors. And so what we did is we looked at the top 13 services utilized by those 65 plus, and then looked at what each state covered by their Medicaid program. So community water fluoridation looks obviously at the percent of those that are receiving fluoridated water, and that comes from the CDC. And then the state oral health plan and the basic screening survey is data collected by us in-house in working with the ASTDD and the state dental director. So that's self-reported data from 2017. And of course, the state oral health plan. So we look at existence of the plan, but also the extent to which it mentions older adults and if it includes SMART objectives. And then we also look at the status of the basic screening survey, whether it could be a local pilot that was done or a statewide BSS. And then we look at the years it was completed between. Now, all of these variables combined is what we calculate as the overall state score. So just to briefly touch upon methodology, so we take the 6 variables and they're equally weighted, and the reasoning behind that is because there isn't any evidence out there that one of the variables should have more weight or more meaning behind the other. And then we use the standard deviation to come up with that overall score on one scale. So states that the highest ranking state receives 100%, the lowest 0, and then all the states fall in between. So what are the key results? What we can see here is from the oral health status, there are about 1/3 of older adults with severe tooth loss, and remember that's missing 6 or more teeth. We also saw the trend of lower income individuals visiting the dentist less frequently than their higher income counterparts. In terms of the Medicaid services, we saw that 9 states cover all of those 13 services utilized by older adults, and 6 cover none. With regards to community water fluoridation, we saw that 15 states are covering 90% or more of their communities. With regards to the state oral health plan, 34 states have plans, 31 of the states include older adults, and then 12 use the SMART objectives. And just as a reminder, those are specific, measurable, attainable, relevant, and timely. And then with regards to the basic screening survey, 23 states have never completed one, have no plan to do so, but we see that 6 states have completed a local pilot and 10 a statewide pilot between the years of 2013 and 2017. So where does Texas fall within all of this? So these are the results for Texas and the data we gathered. We see about 32% of Texans 65 plus have severe tooth loss, so just about within the average of the nation. About 62% are visiting the dentist, and about 66 is the average nationwide. Unfortunately, Texas provides 0 coverage of those 13 benefits. Community water fluoridation is somewhat strong with 79%, and then there is no current plan in 2017, and there's also there's no current basic screening survey or updated, up-to-date one, but there is a plan for one to be done in 2018. So within the state rankings, these are the results, and don't feel like you need to read that image. That's just there for kind of decoration. But of course, we encourage you all to go to our microsite at astateofdecay.org to get all this information and to download that graphic there. And so what we see is these are the overall results. So we have 5 states who are in excellent standing, 6 good, 14 fair, 26 poor, and where Texas falls is ranked as 46th this year. And so we really hope that you're not discouraged by this. We actually hope you're motivated and see that there is opportunity to progress. And later in the presentation, I'll talk about how some of the other states who were in similar situations in 2016 and 13 were able to really improve their score with a couple of strategic plans. So just to take a step back, one of the goals for the report is also to be able to track trends and to compare between from report to report, but also to be able to evolve. So if there are new variables out there, we want to be able to include that, and we're lucky enough to work with biostatisticians at Brandeis who are able to manipulate that data to give us a comparison. So here I just wanted to talk about some change in variables. So in 2016, we looked at edentulous or the loss of all teeth. And then we shifted to what we call severe tooth loss, loss of 6 or more teeth, because we wanted to capture all those individuals that, because really at losing 6 or more teeth, you're experiencing difficulty with chewing, with nutrition, etc. So we wanted to make sure we were capturing all those individuals. And then a new variable we introduced was the dental visit in the last 12 months. And even though, you know, some might say that this is really more of a behavioral, looking at behavioral trend of the older adults, it also gives us some insight, as our committee said, into, you know, can older adults get to the dentist? Is there have been enough awareness or education that they need to be visiting the dentist in the last 12 months? So we thought it would give us some really good insight. So I know this is a very overwhelming slide, but I wanted to provide you, you all are going to get the slides at the end of the webinar. You're going to have access to them, so you can take a deeper dive into reading all these. But I just wanted to kind of share what the changes were from the last report in 16. And so one of the major trends, which we were really excited to hear about, was that more states were taking action. So in 2013, we actually opened our report by stating that the oral health of older adults is in a state of decay. So I think it's pretty amazing that now in 2018, our main theme and trend is that states are doing something about this. And so we see that more states, 5 more states are covering those 13 services, and two fewer are covering none. You can see there's only a slight change in community water fluoridation, but that's actually an increase of 2.2 million people who are being covered. So we see that as a win. And while there are fewer state oral health plans, there are actually more with SMART objectives that are about older adults. So we see that as a positive as well. And then there are 6 more states that have conducted the basic screening survey. So this was really exciting for us to hear. Now this graphic is really interesting because it shows how states have moved within the last 2 years. So how you read this is, if you look at the dotted line, the closer you are to that red dotted line, it means the less you veered away from your score last time around in 2016. And then it also changes, so the further away you are means that your score changed dramatically, and then the quadrants show, you know, positive change or negative change. So you can see where Texas lies is that bottom quadrant there on the left, and so you can see that it's semi-close to the line, so there hasn't been a big change and that there is progress needed. And you can see I pulled out the data. So in 16, Texas ranked 43rd, and then this past one in 18, 46th. So something new this year was we introduced an analysis on national data. So what we did is we took the BRFSS data of severe tooth loss and recent dental visit and associated that with socio-demographic factors, so such as income, education, age, gender. And so this is obviously not very surprising to all of us. We know that the strongest correlation was with income. So the more, the higher income, the more you were seeing a dentist and the less severe tooth loss you had. But the reason that we wanted to shine light on this is the fact that older adults are in a unique situation in the fact that they are living on fixed incomes. The AARP's Public Policy Institute actually says that the average income of an older adult is about $31,000, but really half of those individuals are living on incomes less than $19,000. So if we think about all the competing priorities that older adults are faced with, we can really start to think about, we have to start thinking about solutions that are looking at the older adults as a whole and not just within our little sphere. But some additional observances that we thought were interesting were that women were more likely to see the dentist. Education was also very indicative of better oral health. I know there have been past studies on that as well. And then marital status, we saw that divorced, widowed, and separated individuals were more likely to have poor oral health than married individuals. And so one of the assumptions that came out of that was this idea behind social isolation, depression, and lack of social supports is really playing into this factor. So we thought that was interesting. Okay, so now we can get into the policy recommendations. So Oral Health America has put forth a set of 5 policy recommendations that are that work with the different variables we looked at this year. And then I'll talk about some of the tools we've created for all of you to be able to take action on some of these. Obviously, one of the biggest issues is Medicaid coverage. Obviously, we see that with Texas, but we know that it saves states money. There's a lot of information on that. Marco's group does a lot with that from the Health Policy Institute, and it's a less costly alternative than utilizing the emergency rooms. Of course, one of our biggest priorities at OHA is integrating a comprehensive coverage in Medicare. We know we've done extensive consumer research over the past 3 years, and we found that consumers, over 90% of consumers want this benefit. They actually expect it and are surprised to learn that it's not included. And of course, we know that poor oral health associates with lower self-confidence, and we saw earlier about social isolation and those other issues. Of course, we want to continue sustaining or expanding community water fluoridation. We know from the public health community that this is the most cost-effective and equitable way to be able to as a preventive measure and intervention at the population level. Let's see. Okay, and then of course we want to emphasize the importance of state oral health plans and the basic screening survey. So the state oral health plan really builds a map for states, and it shows the state's prioritization about older adults' oral health. And it also gives us a way to track and set goals for ourselves and come up with I think innovative, very state-specific ways that coalitions and different stakeholders in the state can come together to make some of these things happen. And then, of course, the basic screening survey, as I said earlier, it's really important for us to know the need and to establish the need. And so having an idea of the status of the older adults' oral health is really important in driving decisions about the types of different interventions we want to introduce. So as I mentioned earlier, there's so much more to a state's score than their number. I wanted to share, so what we did is we introduced what we call state spotlights, and it gives the state an opportunity to talk about efforts in the state. And so I'll just share our Alabama's today, but basically what happened in Alabama is in 2000, it's no surprise that, oh, I'm so sorry. Okay, sorry about that. So in the last 2 reports that we've published, Alabama had ranked either 50th or they had tied for 48th. So we wouldn't be surprised to see them in that bottom tier again, especially with some of the challenges that we see in their state, particularly the fact that They don't have Medicaid expansion. There's a little support for the Medicaid adult dental benefit there. They have large rural areas throughout the state, making access a challenge. And then their population has a lot of comorbidities and suffer from a lot of chronic diseases like diabetes. But what actually happened is Alabama went from 48th place, they jumped actually up to 30th. And so how did that happen? Well, Dr. Conan Davis, who was formerly the state dental director, and he's now at the University of Alabama Dental School, they actually saw this report, and he saw this report in 2016, and it was very alarming. So he brought together a coalition of partners, stakeholders from the School of Dentistry, from qualified health centers, the Dental Association, the Public Health Department, and created the State Oral Health Plan with SMART objectives for older adults in 5 key areas. So that included increasing access to oral health care, professional education and integration, improving health literacy, capturing better data and surveillance capabilities, and focusing on prevention of oral disease. So the state was ready to put that action into plan. They started through the school. They were able to get grant-funded portable dental equipment and start providing the services to those seniors. So it is possible, is what I want to say. There's a lot of opportunity for Texas and for stakeholders in your state to come together and do the same sort of thing. And we want to make sure that it is very simple and easy for you to do that. So I'll talk a little bit about tools, but what we found out, so the first time we presented this report was at the National Oral Health Conference, and when Arkansas saw what Alabama had done, they said, oh wait, we want to share what we're doing in our state. So they approached us, and what we're going to be doing is I'm happy to announce that the state spotlights are going to be continuing. We hope to release Arkansas very soon. We'll be looking at Illinois and Maryland, and they'll be ready every other month on our microsite. And so if there's interest in Texas doing a story about maybe how the basic screening survey is coming together or things along that nature, we are more than happy to work with you on that. So like I mentioned earlier, there are a lot of states that took action this last time around. And so what we wanted to do was not only provide you with the report itself, but all these tools to make it super easy for all of you on the ground. So we've put together just a couple of sample key messages that you can find on our microsite. You can feel free to pull those. Maybe you wanted to write a blog and kind of raise awareness about this issue and share that with your networks. And so, we're happy you can pull any of this word for word messages and reuse them and repurpose them for any way that you see fit. So this is a big one. So how do you talk about your score? Particularly if, whether you're doing really well or you're needing improvement. We worked with Tanya Dorfbrunner from ANOC to make sure that we could come up with some messages about how to talk about your score. And so what we did is we created kind of a setup, an intro that you could use, but then we left open an area that you could add some tailored explanation. So what you want to do is point out the areas in which you are working really well in your state, and then point out that there are shortcomings, but here's our plan. Here's our specific plan of what we want to do to change that and to improve oral health. Again, and we've come up with a couple of different prompts that you can select for, but of course you can feel free to include your own messages within that. And then, of course, if you're approaching decision makers about community water fluoridation or about Medicaid particularly, we have a really simple step-by-step guide on how to put together a one-pager that you can leave behind after your meeting. And we actually also have a Word document that you can download, so you can easily add or erase, and it's utilizing the policy recommendations we included in our report. But you can feel free to download that and make it your own, and however you know, the messages that you're trying to use. And then, of course, we want to spread this message on social media. We have a social media guide and a really great infographic for those of you who don't want to read a 26-page report. We have this great, just one-pager snapshot of the results from this year's report. And then, you know, if you wanted to share anything about your thoughts on the State of Decay, we hope you'll join the conversation online with this hashtag. And then lastly, I just want to end with looking to the future. So, you know, in 2020, looking ahead, that our next report would be coming out in 2020, and we want to answer no to the question, are older Americans living in a state of decay? And this is a special year because it's also going to be the 20th anniversary of the Surgeon General's report, Oral Health in America. So I think it's going to be interesting to see where we were at then in 2000 and where we are now, and what we can do to continue improving. And we hope to hear from you on any suggestions or things you want to see. I think some of the challenges in this report particularly is being able to find the most recent up-to-date data. So that's why we wanted to, and also being able to find state-by-state based data, because of course that's the type of report we're looking at. So that's why we wanted to create these tools for you that you were able to tailor, so you can make sure to include the most accurate and up-to-date information. So that kind of takes me to the end of my presentation. I'm obviously open to answering any questions. So,
all right.
Thank you so much, Bianca. We appreciate that. That was a wonderful presentation. And Beth is going to go ahead and moderate the questions. But before that, I actually had a question, if you'll entertain it. What are some objective and state-specific ways that you're aware of that Texas can improve our score? And what items do you think are the most actionable for those of us in Texas who are here on the call and want to sort of move that needle forward? What would you suggest?
Sure. So I think it's really important for a state to set a state oral health plan. I mean, to me, that's just kind of the tool that sets forth, you know, you bring together all the stakeholders who have, you know, stake in this, obviously, and together you map out, you know, what are our goals, what are we trying to improve, what specifically, and then, you know, it's so important, and the BSS go really hand in hand, because you want to use the BSS, okay, this is where we're at in terms of the status of the oral health, you know, what's going on in the mouths of the older adults. And so from that, I think you can start to build your goals and your objectives, and I think it's always good to have, you know, piece that people have and centered around that you're working towards. And I think that once that is in place, the other start to follow, I guess. So I think it's important to have a plan, and then that's kind of how all the other pieces come together, if that makes sense.
Okay.
Yes.
All right, thank you. Let's take a question from Marla. Can you speak more about SMART objectives, and can these replace a state oral health plan?
Sure. So SMART objectives are included in the state oral health plan. And so ASTDD has a really great guide that we recommend using, both for the basic screening survey and the state oral health plan. And I believe they're about $10 to download, and it goes through step-by-step, like everything you need, from who should be at the table to what kind of goals should you be setting, what's so it gives you all these prompts to think about, and does a really nice job of laying out how your plan could look like. And so that is our recommendation, is to utilize that guideline. And the reason it's important to have SMART objectives, which are specific, measurable, attainable, relevant, and timely, is it really hits on all those fronts. It really makes it achievable, and I think it makes it very specific and easier to move forward, versus if it's very vague, you don't really know if you've done anything. It makes it a lot more difficult to measure on the end piece.
Okay, thank you, Bianca. Sebastian would like to know how much of the change is due to other states worsening.
Oh, that's a good question. I've not looked at it that way. So obviously, oh wow, that's a good question. So I think that I haven't done the analysis to look at how many more states are worsening. I guess if I can pull up that chart actually to look at. That chart that has the quadrants from 2016 to 2018 really spells out for us progress needed and declining. So we can see there are a handful of states who declined from 2016 to 2018, but really you see the majority, so it looks like about 3/4 of the state were either maintaining a good score or improving in some sort of way. But, a good portion of them were kind of staying, stagnant. So I guess that's kind of, analyzing that graph can kind of tell us more.
Okay. Let's see, Lori Cafano wrote in to hopefully remind everyone that the ASTDD BSS materials are free to the ASTDD members, and that's Association of State and Territorial Dental Directors. Basic screening survey materials is what she's referring to. So you can go on the ASTDD website to pull those up if you're a member. Our next question, go ahead.
I was going to say, Lori, she was on our committee and was really helpful with all of that, so I'm glad she was on to do that shout out.
Yes, and she's from Texas. She lives in Texas now, so we're happy to have her.
Yes.
Our next question from Danielle: where's the SMART guide from ASTDD available online?
So I don't know ASTDD's exact website, but if you Google ASTDD basic screening survey or state oral health plan, that should be like the first thing that pops up on Google. And I know that because that's what I do.
Yeah. And the SMART guide is there as well. Just write in SMART.
Yes. You don't even have to write in. It's already embedded in the state oral health plan.
Okay,
guide.
Great.
Yeah.
How is it determined if a state oral health plan was available? The list on the CDC oral health page? Where might people find the state oral health plans?
Oh, sure. So for the state oral health plan and the basic survey, that data was collected through the state dental directors by OHA last year in October and November. And it would have been self-reported from the dental director at the time, or whoever the contact through ASTDD is.
Okay. Let's see. Lori wrote in the URL for the ASTDD website. It's www.astdd.org/.
Oh, perfect.
Is where you can get that. Let's see. We have one other question. And again, both of you addressed it a little bit about where can they get a copy of the slides after this presentation?
So all of the slides will be available on the ROHDEO website. All of the recordings that we have of all of our webinars, as well as speaker information and PDFs of slides, are available on the webinar tab of the ROHDEO website, which is www.rohdeo.org. And Bianca has graciously provided her slides, and we will post those most likely tomorrow. If you are registered for this webinar, you will receive a email from me, Annalise Cothran, and it will provide you with a link to the webinar recording on YouTube and to the slides located on our website. So thank you so much for asking. If there aren't any other questions, then I believe that all we have left to do is to thank Bianca for her time. It was a wonderful presentation. I know that both the Texas Oral Health Coalition and ROHDEO appreciate the time that Oral Health America spent putting this report together and highlighting the state of Texas so that we can go back and be change agents for our state. So thank you again, Bianca.
Thank you so much, everyone. And obviously, yes, please feel free to contact me with any more questions. And I'm not always the expert in the questions, but I can find you who is and connect you to that person. And particularly with state oral health plans, please get in touch with me. I'm happy to, make that connection with who you need to talk to in your state and things of that nature.
Perfect. Wonderful. Well, thank you again, everyone. And thank you, Bianca. And this concludes the presentation.
Thank you.
Thank you, everyone.
Thank you. Bye-bye.